Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about a pretty darn simple, inexpensive, can do at home, uncomplicated, safe approach that can potentially save a life, but certainly improve lung function and reduce both the potential for pneumonia or the consequences or the consequences of pneumonia. But before we go into that, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So before I talk about inspiratory muscle training, I'm going to talk about this particular study looking at, it was a smaller study looking at 52 people. Average age was 82.6, and it followed them for 8 weeks. And all they did 2 times a day was use something called an inspiratory muscle trainer, where basically you just put it in your mouth and you breathe through. It puts a restriction on how you breathe in. You can dial in to make it harder or easier. They did this twice a day for 30 breaths. I don't know, maybe 2 minutes, 3 minutes. So 6 minutes a day. They did this for 8 weeks. And they looked at something called the cough, or how much they were able to cough peak flow, how much they were able to kick out when they coughed. And they found that, first of all, when we look at that, to give a reference for numbers, in general, the cough peak flow, or CPF, like 161 or 160 liters per minute is like the base amount that you want to be at. 270 and above is what we really need to kind of kick out the secretions that might form. If we can't kick them out, they stay in our lungs and they start to not only produce wonderful environment for bacteria to grow, but now we're getting less oxygen perfusion. So they found that after 8 weeks, the difference between the placebo group and the group that was doing the inspiratory training was 36.3. So it's definitely an improvement. It wouldn't take somebody to 160 to 270, but this is also just 8 weeks. And it's a really simple, I'll put a link in the description, but if you have respiratory problems, then something like inspiratory training, which strengthens the diaphragm. We're not talking about the breathing out. This is the strength of breathing in. And the more we breathe in, the more it opens up the lungs and expands everything, allows oxygen to get in there and for secretions to then come out. I really do feel that a lot of, whether it's post-COVID or whether it's the respiratory problems that come from that, stem from this idea that once we start having some chest pain or some problems breathing, that we don't push it. And but if we look at all the other like respiratory training, it's designed to increase the amount of air that we blow out and blow in. But we're gonna, when our respiratory system is challenged, I feel that a lot of people don't push the boundary. Instead, the less you breathe, we start going on this downward cycle, and something as simple as inspiratory training may be able to help turn that around. And it's a device that you can sit and put in your drawer on your desktop. It's just simple to do. 30 breaths twice a day to potentially improve lung function and reduce your risk of both developing pneumonia and the complications of pneumonia if you happen to develop it. Seems like a pretty simple thing to keep in the drawer to me. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.